All right, everybody. So hello and welcome to this session. My name's Dr. Jane Valentine. Jane is perfectly fine. And I'm going to talk to you a little bit about the extended medical degree programme at King's. Firstly, though, a little bit of information about King's as an institution. We're world renowned for our education and research. We're rated 7th in the world, in the UK, the world would be brilliant, in the recent Times Higher Education University rankings. And second in London out of the London medical schools. Incidentally, this is one of our students here on the right, James Fraser, who everybody on campus knows. He's very famous. King's is really, really diverse. It's a great place to work and study. There are all manner of people there, and that really brings a richness to the environment that you don't get at some of the smaller and non-city-based places. So about the EMDP then, another one of our students there, Sahid. Our entry requirements are quite specific, so I recommend you go to our prospectus online and have a look at whether you're eligible. But these are them in a nutshell. As I say, you'll have to look at your individual eligibility. But for the main part, it's for applicants from non-selective state schools. So those are your kind of comprehensive academy schools. And you can go to our website for more information. You can see that our grade requirements are slightly lower than they would be for a standard 5-year medical programme, because this is a widening participation route into medicine. So we require you to do both chemistry and biology to full A level. One of them must be an A. And then any third subject for A level, except the usual, so standard general studies, etc., are not allowed. You also must have a minimum of grade 6 in English, language, and mathematics, and you must take the UK CAT in the year that you're hoping to apply. The UK CAT registration is open already. We recommend if you're intending to apply for medicine in October this year, that you do the UK CAT as soon as possible. With the current situation, there may well be delays in getting you to your test centre, or you might be able to take it at home on one of their online platforms. There are also bursaries available for the UK CAT. So if you are from a lower income family, you're able to apply for that bursary by the 1st of October, and that will pay or reimburse you for the cost of the UK CAT. And then you would apply it to UCAS in October. The deadline for that's October 15th. So in terms of how the EMDP works, effectively on our standard programme at King's, which is 5 years long, 6 if you take an optional IBSc, we extend the programme by an additional year. So it's 6 years plus an optional IBSc year. And how it works is our standard programme has 3 stages. Stage 1, which is 1 year, stage 2, which is 2 years, and then stage 3, which is 2 years. So a kind of 1 + 2 + 2 model. And what we do is we extend that slightly. So we use a 2 + 2 + 2 model. So on the EMDP, you complete each of the different stages over 2 years. The only difference being how we deliver stage 1. So for the standard programme, you would take stage 1 in 1 year. That's all the basic science associated with medicine. And on the EMDP, you take it over years 1A and 1B. But you sit exactly the same exams, exactly the same pass marks. You end up with exactly the same degree at the end of it. But what that does enable us to do, because we've created more space in the programme, is offer additional support. And what we do there, if you look across the top bar, these are the 4 main core modules of the standard stage 1 curriculum. And you can see that they're in yellow, green, red, and blue. Now, on the left-hand side, you can see that we split the year 1A modules. So you'll take 2 and a bit modules in 1A, and then the remainder in the 1B year, the second year. And alongside that, you'll take a non-credit bearing module across 2 years, which is called the EMDP specific curriculum. And that tends to be things that are going to help you along the way to learning the core curriculum. And I would describe it like this, actually. So if you look at this diagram, this is apparently the world's most accurate pie chart, according to Twitter. And you can liken the core stage 1 curriculum, or what you need to know for your MBBS curriculum, as the darker, shady side of the pyramid. But actually, it's not just that you need to know. It's also about how you consolidate your knowledge and how you use and develop transferable skills. And they're the things we concentrate on the EMDP specific curriculum. And these are the things we tend to use to do that. So they tend to be small group settings with extra subject-based tutorials, lots of interactive revision quizzes, but also lots of core skills development. So working on communication and presentation skills, helping you think about your professional identity and helping you on your way to developing that. Helping you with independent learning and research skills. And we also use lots of problem-based learning, which isn't used on our standard course, but we use it quite heavily within the EMDP, and some early patient interactions through community visits and patient educators that the standard program students don't get in stage 1 at all. And this is an example of some of the way that we give that context to the foundation science that you're learning. So the paragraph at the top here is one of our PBL cases. This is an actual case that we use, and you'll be talked through it by your tutor, and then you'll discuss it in small groups, learning what you do and don't know, and then going off to do independent research so that you then come back together, present, discuss, and have learned about that topic and its relation to medicine by the time you have finished the session. And as I said, we also use a range of patient educator sessions. So these are real life patients with proper real conditions, not actors, who come in, talk to you about their conditions, discuss them with you, talk about their patient experience and the things that have happened to them through their lives and how their interactions with medical professionals have changed the course of their treatment, and some patient visits, community mental health visits at local arts facilities. In terms of assessment, there's a mixed assessment method across our stage 1 cohort. So it's mainly written exams, which are single best answer questions, and then an electronic portfolio, which is akin to coursework, if you like. And you can see that the 4 main core modules all have exams or coursework related to them. And we do have a range of assessments that are formative within the EMDP specific curriculum. And by that, all we mean is that it doesn't count towards your end of year exams, but what it is there for is for you to get detailed, individualized feedback to help you when it comes to progressing in the standard course. Another thing that we're able to offer, because we've spread the curriculum out over the first 2 years, is increased pastoral support. Now, everyone that comes to King's, every student, no matter what course, will receive or be allocated to a personal tutor. And that person they will meet with once or twice a term, perhaps, on a one-to-one setting, and you'll get allocated a senior personal tutor as well, someone like me or one of the other 4 or 5 of us across the college. But as well as a personal tutor, EMDP students are offered an EMDP advisor. Now, that person is somebody who's much more likely to be campus-based rather than perhaps across at one of our hospital sites, not so close to home. They're usually much more available. And they know a lot more about the EMDP because they've been doing it for quite some time. And you meet with them throughout the term as a group, small groups still, sharing experiences, learning that, actually lots of you are concerned about the same things and trying to spread the burden a little bit, but also for ad hoc meetings if ever you need to discuss something more personal. One thing we say to all of our students, and I'm saying that to you now, even though you're not our students yet, perhaps you will be one day, is please don't bury your head in the sand when it comes to anything being wrong when you go to university. The sooner your university know about it, the sooner they can offer help. And like us, King's, we have huge numbers of different student services available. And we do know very specifically where we need to send you to get the help you might need, depending on your circumstances. But if we don't know there's a problem, we can't help. So please don't bury your head in the sand like an ostrich here. Other things you might want to consider if you're coming to university, whether it be King's or anywhere else, is recognizing that there's a bit of a jump from college to university. Not necessarily in the first year in terms of content, because the content's not that much different from A-level, but it's about the way you're learning and the expectations around how you learn. So at university, there's much more independent learning and self-direction needed. So you've got to be really on the ball and committed and able to organize yourself and your time and keep yourself on track. There's a greater need to assess your priorities, I think, as well at university, especially medical school. You've got a busy course, but your home life still carries on around you. You know, friends and family, commitments outside of school, outside of college. So you have to think very carefully about how much you prioritize different aspects of your life, how much paid work you might take on or be able to take on in light of the course you're doing. It's a long course, 5, 6, 7 years, depending on which one you do. So you've got to be quite resilient. Life will happen around you during that time. And that's why help-seeking behaviour is really important at university, recognising when you're not okay or when something isn't quite right and seeking help accordingly. That's what we need of our medical professionals and our medical students. We've also got to think about that idea of professional identity. Medicine is a professional programme. The General Medical Council have a guide on good medical practice. That's what they expect of their doctors, but also of medical students. So have a read through that if you haven't already, and it will give you an indication of what's required of you. But it's things like, very simply, making sure you're aware of your social media presence and your behaviour, and keeping those in check. Privatize your social media settings. Make sure you're not blurting out to all and sundry what you've been up to on a Saturday night, for example, although probably not very much right now. Think about your attendance and your engagement, your organisation. The more you engage, the more you will get from medical school, and the more you will get from your studies. We find that the students who struggle are often the ones who don't engage. And then become reflective if you aren't already, and think about why things might not have gone to plan. What could you improve? Recognise your limitations and seek help wherever you feel you need it. As with most universities, King's has a huge student union, a very active student union. There are societies for practically everything under the sun. So if you've got interests in cookery or, I don't know, various sports or anything like that, you will find a student union society there to help integrate you with other people who also like those sorts of things. Make the most of your time at university, whether it be King's or elsewhere, and really get involved in those. It's really positive for your experience. And think about how you might become an ambassador. Again, King's has a really good ambassador program through our social mobility and student success department. And they offer paid work, which is at a really good rate. It's flexible around your studies, and it gives you that ability to work whenever you'd like with students from local schools and colleges, thinking about, why you maybe went into medicine and how they might want to do the same. And we really value the input that they have as ambassadors. They're really the best thing about our outreach program. King's has a huge outreach for medicine team of people that work within King's, trying to encourage people to from all walks of life to study medicine. If you haven't already, then I recommend you look on their web pages or look at Outreach for Medicine at King's and see what they have to offer. They offer a variety of different lectures, online sessions, visits for the day, and things like that you might want to get involved in. So that's me, and I believe Connor's going to talk now, and then we're going to take some questions. So I'm going to stop sharing and hand over to Connor. Thanks for listening.
Thanks so much, Jane. So, hi, my name's Connor. I'm a fourth year medical student at King's, which means I'm actually a sixth year, or going into my sixth year of EMDP. So I started at King's in 2015, September 2015. So I have completed my 1A, 1B year 2 and year 3. Then I've just finished my intercalation. So I've just finished an intercalated IBSc in imaging sciences, also at King's. So I'm one of the more senior EMDP students now. And I thought it would be great just to kind of tell you a little bit about, I guess, life as an EMDP, what the difference is between being an EMDP student. And probably this will be similar to other extended courses or foundation courses. But I thought I'd just talk you through that a little bit. So I've taken some of this information from the King's website. So if you go onto the King's website, you can search up EMDP or the Extended Medical Degree Program, and it will give you the kind of course overview. And on there, that's where you can see the specific entry requirements. You can see the eligibility requirements for whether you're able to even apply to the EMDP. This is what King's lists as the key benefits of being an EMDP, an Extended Medical Degree Program student at King's. And I think a really key thing is that all of the benefits, apart from the first one, are the same as being on the 5-year course. The only difference between the Extended Medical Degree Program and the A100 MBBS program is your first 2 years. And it's not even that you don't cover the same content, you cover the same content plus more. So I think a key worry, maybe for some people who are thinking about whether they're going to be applying for widening access course, such as the Extended Medical Degree Program, is that there might be some kind of stigma or some kind of key difference between them. At King's, I can only talk from my experience at King's, but at King's, no one cares that you're on the Extended Medical Degree Program and not the 5-year course. If anything, once you get into 1B and you're dealing with the 5-year students a lot more, you find out that they're really jealous of the extra content that EMDP gets. So the people on the 5-year course, when they hear about the extra content that we get on the 6-year course, actually wish that they were receiving the same extra support, the pastoral support that Jane mentioned. They wish they were getting to experience the additional kind of patient contact that EMDP gets even earlier than the 5-year course. And they wish that they were getting some of that problem-based learning and kind of additional learning, which Jane Valentine and Steve Thompson, who are in charge of the curriculum for EMDP, have built up. Like the main course at King's, the EMDP curriculum has changed and is changing. So people who would be starting this September will actually be doing a very different course to what I started in 2015. But it's only improved. They've kept all of the good stuff. They've got rid of some of the other stuff, and they've replaced that all with some amazing content. So I didn't actually get a chance to do the problem-based learning, but that's been added in, and I wish I'd had that opportunity. The aims of the Extended Medical Degree Program, why King's has a widening participation course, I hope is fairly obvious. Medicine can often be quite discriminatory in terms of getting into medicine and starting a career as a doctor. It's still, the statistic is still true that 80% of the applications to medical school come from 20% of the schools and colleges in the UK. And so the Extended Medical Degree Program is there to kind of bridge that gap. So I come from North London. I went to a state school. I went to a state college and did my A-levels there. And so that's why I was eligible to apply for the EMDP and why I chose to apply for EMDP. I'm not in any way disadvantaged, as I said before, from being on the EMDP compared to being on the 5-year program. As going into my 4th year, the majority of people won't know that I'm an EMDP student and not an MBBS 5-year student. So there's no difference there really at all. This table, you can also see this on the King's website, as I said before, but this kind of breaks down the teaching you receive and how you're spending your time as a student on the EMDP. So stage 1, which is years 1 and 2, which is where you do 1A and 1B, about a third of your time you have lectures, seminars, small group tutorials, as Jane mentioned. You have a very small amount, it's probably more than 0 now, but you have a very small amount of time in placement. And a lot of your time is doing things like self-directed learning, learning with your peers, doing projects with your peers. As you progress through your time, your 6 years at medical school, just like with the 5-year course, you start to skew your time towards placement rather than kind of lectures, seminars, and rote learning. So thankfully, I'm just at this line here. I'm just about to start my 2 years with pretty much 100% placement learning. I said I'd quickly run through this. To find out whether you specifically are eligible to apply, you're going to have to head over to the King's website and have a real kind of in-depth look through the eligibility criteria. But as you can see, there are some key things. So you have to have not attended a selective school. So you have to have not attended a grammar or private school. You have to be living in an area which is defined as a widening participation area. King's uses the ACORN guide for postcodes. And you also, this has to be your first undergraduate degree. So you can't be, you can't have already started or finished another undergraduate degree before you start the EMDP. As Jane said, you have to sit the UCAT. So if you haven't already, the UCAT is a requirement for the majority of all medical schools in the UK. It's still only a handful that want the BMAT. So you do need to get on and register for the UCAT. Exams start on the 3rd of August this year. They're a little bit later. They normally would have started already. And there's also, there is some special consideration for students coming from a care leaver background. Typically, the kind of offers that you get for EMDP, they're probably specific to each individual, but typically you need to be getting, as Jane said, a minimum of ABB. So that the A needs to be in chemistry on the whole. And then your Bs need to be in chemistry, biology, or maths, or another subject. So that third subject can be anything, really.
Can I just interject on that? So we do require you to have an A and 2 Bs. Okay. The A can be in either biology or chemistry.
Okay.
We don't have a preference, as long as it's one of those.
Yeah, okay, thank you for clarifying. Yeah, so your A can be in chemistry or biology, and then you need to get 2 Bs in other subjects. So that's it kind of from the course perspective. From the perspective of being a student on the EMDP, as I said, there is no difference in what you get up to on the day-to-day, apart from your first 2 years, from a normal 5-year MBBS course at King's. King's is a great uni to be at. It's in the middle of London. It's the most central of any of the London universities. So as a medical student, you spend most of your time at a campus called Guy's Campus, which is at London Bridge, right in the heart of London. The only other campus that you really need to get to is Waterloo, which is like a 10-15 minute walk from there, and again is central London. King's, as a college, as a university, has 31,000 students, and they really are like set up as an institution. So as Jane said, the student union is great. As a medical student, you kind of have your own separate student union, which is the GKT, the Guy's, King's and St Thomas's kind of student union. There's great pastoral support from the academic side, so from members of faculty, and there's also amazing pastoral support from the student union and specifically from what's called the MSA, which is the Medical Students Association. Because there's so many medical students and dental students and other healthcare students at King's in the GKT School of Medical Education, we kind of have our own little subsystem. And even though King's is a city university, most of the time it feels like a campus university. Most of the time you're just spending your time on Guy's campus in London Bridge. You see the same, probably a few thousand people. There's 2 libraries on the main campus, and you can just kind of set up shop and live there, and spend all of your time there. And it does feel like a campus university a lot of the time. I hope that's answered any kind of questions you might have had about being a student. But yeah, if you have any questions about being a student on the EMDP or the EMDP program, or even King's in general, now would be a great time to ask. So I can see James already answered a question about whether you can intercalate. So just for any of you who don't know, intercalating is where you take a year off in the middle of medicine. At King's, it has to be between your stage 2 year 3 and your stage 3 year 4, so between stage 2 and stage 3. So if you're on EMDP, that is between it's your 5th year of university, and it's optional. So in my cohort has 50 EMDP students. I think about half of us have just intercalated. So yeah, some people choose not to because you're already doing an extra year. So we're already doing 1 year more than other students. On the other hand, you're already doing 1 year more. So what's another extra year is how I viewed it. And with funding for the EMDP, as with any MBBS course, everything after your 4th year, you can apply for an NHS bursary to pay for your fees, and that covers your intercalation as well.
Can I interject there as well again, Connor?
Go for it.
We have an access to professions bursary that the majority of our EMDP students are eligible for. So although you're taking an extra year to do your course, that bursary would give you £3,000 per year for the first 3 years of study. So it effectively makes up for that extra year of tuition fees. I mean, obviously you've got living costs and things like that to consider, but it's better than a kick in the face. It kind of helps towards the fact that you've had that extra year of study. And all you need to do is make sure when you're selecting or filling out your UCAS form and your student finance forms, you click or tick the boxes to say that you're happy for them to share your data with your university, and then we would automatically assess based on means testing data that they would provide us whether you're eligible for that bursary. But the majority of our EMDP cohort do get it. Somebody's also said, when would people apply for EMDP if year of entry is next year? So it's up to you. I mean, if you want to, and you're in a position to, so with your A-levels, and you're about to complete your A-levels, you can apply now, you can apply now, and you can either defer your entry or you can make your application once you've got your A-levels. It's up to you. I mean, it's a funny way of doing things. I would suggest you get your application in so that you can start in September. It will be September 21 now, wouldn't it? And then if at that point you decide you would rather take a year away and do something else, you just ask to defer your entry for another year.
Yeah, we've got a few questions about how you apply for EMDP as well. So EMDP is a medical course. You apply for EMDP as one of the 4 medical courses that you can apply for through UCAS. So when you're applying for medicine through UCAS, there are 5 options of courses you can apply for. 4 of them could be medicine, dentistry, or veterinary studies. If you're applying for medicine, then you should be doing 4 medical courses to maximize your chances of getting in somewhere. But King's EMDP will be one of those.
Yeah. You can apply for both programs, but we would recommend you actually look at, they do have different requirements, different A-level requirements. The UK CAT is considered differently across the 2 programs. So it's best, if possible, to ring up the admissions or talk to the admissions team, talk to your school or college and work out what is your best option based on you as an individual and go for that one. Otherwise, you're taking up 2 choices.
Go on, David.
Sorry.
we're going to have to finish there.
Okay.
It is 2:00. I can see there's a lot of questions here. How do you want to go about that? How can they get in touch with you guys? Can they?
So feel free to message me on Twitter or anything. So my Twitter handle is Connor Dibblin. Also, I can hang around for a couple of minutes and try and answer some of these messages in the chat.
Yeah, I'll do the same.
Perfect.
They can get me on Twitter or LinkedIn, or they can just email me at jane.valentine@kcl.ac.uk.